Welcome to the Wholehearted Wellness Podcast. As a friendly reminder, the Wholehearted Wellness Podcast is not a substitute to receiving mental and physical support from a licensed wellness provider. We encourage you to speak with your wellness provider prior to trying any therapeutic modalities mentioned on this podcast. Welcome back, you guys, to the Wholehearted Wellness Podcast. Today, I have a good friend of mine, Victoria Rodriguez. She is a licensed professional counselor, and she also has her PhD in counseling education and supervision. So thank you so much for being here today, Victoria.
Thank you so much for having me, Ariel. I am so excited to be here and to talk with some of your guests about why it's so important for us to have an understanding of how the body works and what happens when the body doesn't work the way it's supposed to. So I'm really excited to get into that conversation today.
Yeah, well said. So one of Victoria's areas of expertise is helping people with medical trauma. So tell us a little bit about what medical trauma is.
Sure. So medical trauma or medical post-traumatic stress disorder is really similar to a lot of other forms of PTSD. And it's really where the brain forms these neural pathways or stress pathways associated with medical experiences. So I always tell my supervisees or my clients that maybe some of us won't deal with eating disorders or we won't deal with anxiety or depression, but all of us have a body. All of us have a body where something can go wrong or we'll have some type of interaction with the medical system, maybe some more than others. And so really what medical trauma is when we experience a really stressful or traumatic event in a medical setting, and we associate either a certain procedure or a certain test or even just being in a medical building or a clinic or a medical context, we can experience symptoms of PTSD. So again, that can look like racing heart, sweating palms, voice changes, shutting down, meltdowns. Again, a lot of symptoms you would see similar. Avoidance, absolutely. So I have a lot of clients that will avoid altogether going back to medical appointments, which is really important for follow-up and management after certain procedures, and they will avoid those appointments and not make those appointments. So it's really important, again, to address that to ensure that they can live a long and happy and healthy life, even after a medical scare.
Yeah. You know, one of the populations I'm really passionate about working with is those with chronic illness and pain, and I know you work with them as well. And what's so tricky, especially with this day and age with certain type of diagnoses like Lyme disease, chronic fatigue syndrome, fibromyalgia, POTS, it takes so long to get diagnosed. And oftentimes they have been to over 30 doctors before they get a diagnosis. I know that happened to me. I went to Mayo Clinic and finally got the diagnosis I need. And so on top of dealing with a diagnosis and medical struggles, to have the trauma with medical trauma as well just adds to their plate. And it's so much. So usually these clients are coming in not just with the hardship of having chronic pain and chronic illness and learning how to adapt to life, but also the medical trauma from the doctors, feeling dismissed, issues with the insurance companies. It's just, it's profound. Really,
its own
really
type
profound.
of medical trauma dealing with the insurance companies denying these procedures. Absolutely.
Oh, yeah.
I will add, so I conceptualize chronic illness as complex medical trauma. So that's the idea that there's not necessarily one event you can point back to. You might be able to correct me on this actually, but I want to say it's an average of 7 years or even close to a decade of getting a proper diagnosis for something like Lyme disease or some other type of complex chronic medical condition.
Yeah.
And so what complex medical trauma refers to is when we have these experiences in the medical system over and over and over again of just small dismissals here, small microaggressions here.
Wrong diagnoses.
And that adding up over time to where you actually start to form a trauma response, again, to some of these medical experiences. I'll have some clients that even have trauma reactions to watching something like Grey's Anatomy or General Hospital, depending on the age of your audience, whatever they're watching. They'll respond to even seeing that on TV or seeing something in the news about a medical condition or a medical disorder, which again, I think speaks to how pervasive these medical issues are.
Well, and I think about when COVID happened and everybody was wearing masks. I thought about several clients that I worked with, and they're like, Arielle, this is just too much. Everywhere I go, I'm seeing masks, and it's reminding me of times that I've had countless surgeries. And then that's the hard thing too, naturally, because humans are not perfect. They're going to miss things, but I've had plenty of clients, including myself, who have been misdiagnosed, who had horrible surgeries or put on wrong medication, and it ends up making things worse. And so it just compounds things. So I love that you use that language, complex medical trauma, because it is. Anything that's complex is compounded with multiple things.
I'm actually going to share a tip that I learned just yesterday about how to address being dismissed or feeling dismissed in those medical appointments.
I love it.
If that's something you feel that your audience could benefit with.
Because
even script writing and advocacy is a big part of our work. So you're going to ask 2 questions. If you feel that you're not maybe being heard in this appointment, or you feel that a certain diagnosis is being dismissed, you're going to ask, what is my differential diagnosis? And that's, if your audience isn't familiar, where you have one diagnosis that is most probably that diagnosis. But then as mental health professionals and medical professionals, we also have to come up with other diagnoses that it could be. So you're going to ask, what is my differential diagnosis? And then you're going to ask, how did you rule out these other differential diagnoses? So it puts the onus back on the medical providers to explain, what procedures have they done? What tests have they run to rule out these other potential diagnoses? So that's something I just learned yesterday that I think will really benefit people who are maybe getting some resistance or pushback in some of these medical systems.
Yeah, I love it. And how perfect timing in coming on this podcast, you know? Wow. Yeah, that's amazing. You know, and with these certain types of diagnoses that I've worked with a lot and actually currently I'm also dealing with personally, and thinking about POTS, Ehlers-Danlos syndrome, mast cell activation, a lot of these specific types of clients not only are experiencing medical trauma, but a lot of the treatments out there due to their specific diagnoses they're often really difficult, you know, and they tend to have flare-ups. And so, you know, that's something I've thought about too, is even when the doctors have great care and empathy, which I have a couple of doctors like that, and they're going over and beyond with care for me and providing the latest research, sometimes the things that are available aren't helpful for these clients, which then adds to their medical trauma. Have you seen that?
I would say particularly, so I will see a subsection of clients who are neurodivergent, meaning that that's very comorbid with MCAS and mast cell activation and dysautonomia, POTS, hypermobility, Ehlers-Danlos. And again, what doctors are taught is that if it sounds like a horse, it's probably a horse. And something famous in the EDS community, so the Ehlers-Danlos community, is that sometimes it's a zebra and we need to rule out that zebra. So again, I think when working with clients like that, it all comes back to advocacy. And again, well within my scope, I really see my job as reflecting back the advocacy skills that you already have and you being able to use that in a medical context, especially if you've been traumatized in that context. When we can have your body feeling safe and secure in those spaces, you are much more likely to advocate for the care that you need.
I did not realize there was a connection to MCAS, Ehlers-Danlos syndrome, and POTS with neurodivergence.
Yeah, it's well documented in the research. I suggest if your audience is more interested in that, they can check out my website after, or they can check out Tracy Rodriguez, no relation, but she talks a lot about the research connecting these conditions with neurodivergence, just because a lot of these systems are affected. Not meaning that it's a caused relationship.
Sure.
It's a correlation.
Yeah.
It's comorbid, meaning that they just occur a lot together.
Yeah. No, I understand that. What is your website for listeners so they know what
Absolutely.
to,
So it's www.victoriarodrigueztherapy.com. So very complex, but hopefully if you get the name at the end of the podcast, you'll be able to type that in. But I have a lot of resources there on advocating for your medical needs, addressing medical anxiety, which again is so important. If you're able to feel, again, safe in your body during these medical appointments, you're just much more likely to, first of all, go back to these appointments and then also advocate for yourself in these appointments. And additionally, information on what medical conditions are associated with neurodivergence or comorbid with others. So again, I want to be very clear that I'm not a medical provider, or rather not a physician, but I do want to make sure that my clients at least have all the latest research so that they can present that to their medical providers in a way that's concise and understandable.
And empowering.
Yeah, absolutely.
Yeah. So I know one tricky thing about medical trauma is it doesn't have an ICD-10 code. So that's a diagnosis. So for counselors, we can't put, medical trauma as the diagnosis. And I tend to put PTSD because it is usually connected with other forms of PTSD. But I'm curious your thoughts on that. Do you think there should be a diagnosis code for medical trauma, or what does that look like? I'm sure you may have a little bit more information on that than I do.
I think there can be pros and cons to diagnoses, just like every diagnosis. So for some people, having that label of medical trauma can be so empowering. Because I will see a lot of clients, especially those with complex medical trauma, that will say, I don't understand why I get scared for every appointment. This shouldn't be that hard. I'm a doctor, or I'm a lawyer, I'm another professional. Why am I struggling so much with this? And to be able to give them that label and say, hey, what if we started exploring medical trauma? Does this sound like you? How much do you resonate with these items that we're bringing up? And again, it can be very empowering for them to say, this isn't in my head, so to say. This isn't something I'm making up. This is very real. It affects the neurobiology. It affects the way I move in the world. And in some ways, that can be empowering. On the other hand, we also know that sometimes having a diagnosis of PTSD can affect one's ability to be employed in certain sections. It can affect their ability to get life insurance. So I think that clinicians would have to weigh the ethics and the cost to the client based on whether we were to formalize medical trauma as a diagnosis.
Sure. It's interesting in your first point. I think about so many clients that they get relief finally getting a diagnosis because they have just been searching for one for so long. But then there's also a level of grief and can happen to have some trauma from being like, wow, I'm just collecting diagnoses like eggs on Easter, And so that's another really good point of being mindful and attuned to your client and knowing what will be therapeutic for them.
Absolutely. And I think in the future, if we can get a little controversial on your podcast, I don't think it's that controversial, but I think in the future, we're going to understand that these certain medical diagnoses are going to have to also be treated by a team of mental health professionals. We know that inflammation plays a major role in how people experience chronic pain, acute pain. And I think we're going to get to a point in the future where everybody who has a medical diagnosis that could benefit from a mental health professional is going to be immediately offered a referral to a mental health professional, because we're going to recognize how much these items interplay, if that makes sense.
Oh, absolutely. Well, and I even think about, I read this incredible book, and I have it in my library, but I don't remember what it is. But it was talking about how when you have a certain amount of inflammation in your body, it can pass the blood-brain barrier and cause depression, which is why a lot of people right after getting sick or surgery struggles with depression. So think about somebody with a chronic illness who is just chronically inflamed. Of course, that is going to cause depression. And not just from the fact of like, man, this sucks, but like, no, biologically, neurobiologically, you are experiencing high levels of inflammation and therefore depression.
Well, and let's talk about stress. So even before we started recording, we were talking about how when your nervous system is stressed in a hospital setting, I mean, you can just imagine it, the uncomfortable beds, the terrible sheets, the terrible overhead lighting, the noise, all of that stresses out our nervous systems. And so it's almost this feedback loop where when our nervous systems are not performing their best, our bodies are maybe not doing the best job that they can at healing itself. And then on top of that, when our bodies are sick, it really affects our nervous system. So it becomes this terrible feedback loop where we're really getting overstimulated in these settings, which again, I think speaks to the importance of prioritizing comfort when you have medical trauma or you experience a traumatic medical event.
You know, there's a part of our brain called the amygdala, and I call it our watchdog. It receives information through our 5 senses, and it's constantly looking for any potential threat. And the beautiful thing about that part of the brain is if it detects danger, it turns off the rest of our brain, and it sends signals to our adrenals, hey, you better start pumping adrenaline. We got to get the heck out of here. And interesting enough, if it's a short threat, so maybe you're on a hike and you see a rattlesnake and you jump, you get away, you're safe, that actually can strengthen your immune system and your nervous system. It was not built to be chronically on. And so for people that have complex trauma, chronic stress, and complex medical trauma or chronic illness and pain, that part of their body called the HPA axis is constantly on, and it drains it. And then it ends up causing, immune deficiency and chronic illness. And then, of course, which is a whole other podcast, but epigenetics,
right? Right.
And what genes are turned on and turned off. Yeah. So what does a counseling session look like for you, and what do you recommend counselors doing when working with somebody who's experienced medical trauma?
So I can first talk a little bit about how I work with medical trauma. So I think first and foremost, I offer only telehealth therapy. That's not for everybody with medical trauma. It's not for everybody with chronic illness.
But it's accommodating if you're homebound.
Absolutely.
I get it.
So if I have a disabled client or a client that's having a flare-up or they're recovering from surgery, telehealth is an opportunity for them to still receive counseling services from the comfort of their own home. They don't have to travel in a vehicle. They don't have to bring any of their accommodating items with them. So I think just first and foremost, telehealth in and of itself can be a modality that can be really helpful for these populations, for these people. Additionally, one of the first things that we'll work on, so I love how you brought up the amygdala, because I talk about the biology, right? About how if you're having an ICU stay, which by the way is the most correlated with developing medical PTSD. And it makes sense because it's a life or death situation. It is probably one of the most stressful experiences that we can have as humans in the modern age. And so one of the first things I talk about is the biology. And we have a conversation about, in some ways, how your brain is doing exactly what it's supposed to do. These stress responses you're having are trying to tell you that something is very wrong and that you need to escape. A lot of my clients will even describe staying in the ICU and just feeling really trapped, like an animal. They'll use that metaphor a lot. And I'll say, even though it's not helpful at this time, it sounds like your brain was performing in exactly the way that it was meant to when you're met with something really stressful, like an
Yes.
ICU stay.
That's such a beautiful point. I realize I'm cutting you off
No, please
here,
do.
but that's actually something I'll do a lot with my clients with complex trauma, chronic illness, and medical trauma is parts work.
Mhm.
And even how can we, if you could pick out a miniature that represents your chronic illness or your amygdala, how do you feel about that? How do you feel about this part? How do you have a relationship with your amygdala? Which sounds kind of funny, but there's externalization there. And sometimes just realizing, wait, this part of me is precious and has helped me stay alive ends up disarming some of the stress, which then also helps some of the recovery as well. Have you noticed that at all?
And I think it takes away the shame and the guilt
Yes.
sometime with these symptoms. So again, I go back to a lot of my clients will say, I don't know why I can't keep these medical appointments. I don't know why I'm so stressed before these appointments. And so to have a conversation of this is exactly kind of what your body is supposed to do in these instances can at least help to address the shame and the guilt with those autonomic responses.
One of the specific medical appointments I find people have the hardest time with, I am one of them. I have canceled so many times, y'all, is dental appointments. Oh my goodness, but that makes so much sense. One, it's so painful. And anyways, there's a lot of different things there, but I have found doing EMDR and future templates to be very helpful, specifically with appointments in the future. They're like, Ariel, I've canceled 3 times. I need to go. I'm like, okay, we're doing EMDR. We're doing a future template. And that has been something that's been very helpful for them.
As someone who just rescheduled a dental appointment, I can agree.
Yes.
Dental anxiety is actually the most common
Yep.
form of medical anxiety, which I think all of your audience could guess
Right?
from that.
I don't think anybody's like, that's my favorite time of year.
Well, and again, so I'll speak from my own experience. I had gone to a dentist that did not prioritize comfort, and that was fine. I thought, I'm just in to get a cleaning. I'll go in, be uncomfortable for an hour, and be out. But what ended up happening is that I would come to dread these dental appointments. And that's just not where I wanted to be for my dental health.
Mm-hmm.
And so I ended up having to reschedule, oh my gosh, at the bougiest dentist I could find.
Yes.
And it's like going to a spa.
Yep.
They put on whatever music or TV you want. They give you an eye mask. I mean, they have created quite the experience.
Yes.
But it's not silly.
No.
Because what
no.
it does is it's basic psychology. It makes my brain associate going to the dentist with something comfortable and inviting, meaning I am much more likely to keep these appointments later on.
So who's this dentist for me and the listeners?
Dr. Claymont in Thibodaux, shout out to all my hygienists there. But they do
Okay.
offer just a great, they have bird feeders outside.
Oh my gosh, yes.
But again, I think, we could say this is a silly conversation, but that's a dentist that has really understood what it means to make your patients comfortable and how important that is to making sure that they come back for these appointments. So I think, again, that speaks to their trauma-informed practice.
Getting vulnerable over here, there's 2 things that I have needed to do since 2020, and I have not. And one of them is see a cardiologist to get tested for POTS, and the other one is see a dentist for just a general cleaning.
Mhm.
I cannot do it. So I understand, and I realize that is incredibly disgusting, but it's true. But I'll tell you a story. When I was in 6th grade, I had 10 baby teeth still just hanging in for dear life, and they did not want to leave. They said, I'm here to stay. So my dentist had to pull them out. Well, it ended up taking him 4 hours. He had to give me 16 shots. They did not want to leave. He had to cancel his appointments. And so I know, man, that and then braces and headgear, which I know a lot of people have experienced, that plays a lot into not wanting to go. And then the sounds you hear, it's all kind of things. So Yes, I personally understand and am there with you. So, yes, I'm going to actually be checking on your dentist.
Well, and again, it comes back to a dentist might also be the first medical provider that we really have contact with outside of a pediatrician.
Wow.
So I'm sure a lot of our teens can remember going to get braces for the first time, going to get cleanings for the first time, and we're young and small and not empowered to make our own medical decisions. So again, I think maybe a dentist would be an interesting person to talk to about that,
Yeah.
but they also don't, except for Dr. Claymont, may not receive a lot of training on trauma-informed practices.
Sure. You know what's interesting that I actually learned from a dear friend, Jen Malonsaw, recently? Our mouth and jaw is connected to our pelvic floor.
Hmm.
And I thought about that and I thought, wow, how vulnerable is that even for people that have had sexual trauma, sexual abuse, and they're like, I don't know why I don't like going to the dentist. Those two areas are connected. And it's also really interesting even thinking about women that avoid the dentist and the gynecologist. And I'll ask, well, do you tend to have pain in your pelvic area? They're like, actually, yes. And so I've referred them to Jen. And I'm like, let's work on that area first, relieve some of the pain, and it actually may help you be able to go to these two appointments. Isn't that interesting? And thinking about different parts of our body, you would never think we're connected,
I've heard that before, though, that the pelvis, again, stores. So I have a friend in Georgia who specializes in just pelvic floor issues, but she's a mental health practitioner. And she'll say things like, so much trauma is stored in the pelvis, especially for people who are socialized as women or people who have uteruses, that it can be a part that just holds onto that trauma more than other parts. So certainly I would be more interested to learn about that. That's really cool.
Yeah, really, really cool. Well, awesome. So what would you recommend to healthcare providers that are in a stuck system? I know when I went to Mayo Clinic, I was talking to one of the doctors and I was like, listen, a simple assessment that you should do is the ACE, the 10-question adverse childhood experience, so that you can understand people's trauma background. And what blew my mind was he said, Arielle, it would take us over 10 years to get this approved for just me to add this one simple assessment. And I thought, wow. So I think about people like him who's in a system but wants to be sensitive to those with chronic illness, chronic pain, and medical trauma. What would you recommend to those healthcare providers?
I will say probably the majority of my clients that I see right now are healthcare providers themselves. Wow. So I think it's important to remember that not only are they dealing with their own chronic health issues, but this system that they're in really adds to those chronic health problems. Mm-hmm. It's incredibly stressful and can be incredibly unsupportive in these settings. So the first thing that I always suggest to medical providers when they are working with someone who has been in a traumatic medical experience or experienced a traumatic procedure or event is asking about comfort first. Mm. And there are a lot of providers that already do this. So,
which would disarm the amygdala.
Exactly. So what I always suggest, and what a lot of them are taught, but maybe is not in their protocols or procedures, is to ask, what can we do to make this more comfortable? Or the OB, can we make this chair a little more comfortable for you? Can we make this sitting a little more comfortable for you? What can we do to help you feel safe? And if they're able to accommodate that, great. If they're able to accommodate that even only a little bit, it can even communicate caring and trust to this client to ensure, or to this patient, to ensure that they come back and continue that continuity of care. So first and foremost, even the simple question, if they're not able to get to all of the ACEs scores or do a full trauma examination, is asking them about their comfort levels. Mm-hmm. Because again, it goes back to the body keeps the score. All of the research we know about the body and trauma is that if you are able to help them feel comfortable, they are less likely to associate you with a traumatic medical event.
Yeah. I mean, it makes complete sense. You know, one of my favorite things that disarms the amygdala is connection, empathy, and attunement. And so even just that, you'll be able to read your patient and client's face and body language if they are not comfortable. Because I know I've been in those situations. If they ask me, "Hey, are you comfortable?" I'll say, "Oh, yeah, I'm fine." And then I don't realize, hey, you were not honest there in that moment. And so even attuning and watching the body language in the face and offering, I find has been helpful too. I think about like with grief, asking, sometimes they won't say yes, but if you just do it, they're so grateful. So that's a really, really great point of just, hey, what are you doing to help them feel physically and relationally comfortable?
Mm-hmm. Absolutely. I mean, the relational aspect can't be overstated. It can also look like bringing someone in with you to an appointment if you need that, if
As
that's
your
an
advocate.
accommodation you need. Absolutely. Your advocate, even just someone to body double with, or to say, I have a warm body in the room with me of someone who cares and is going to be there for me, can strengthen your advocacy skills.
Yes.
So sometimes that's somebody on your medical team. Sometimes that's a family member or even a friend at that appointment. And if that's the accommodation you need, then that's the accommodation you need.
That's something I've noticed is I'll ask my husband to come with me. And it's multiple reasons. One, he helps me regulate. Two, it's easy for me to not even realize I'm trying to push through the appointment and forget to share things. And he's like, "Oh, no, you need to share this." But also, he lives with me. So there's things that I'm like, "Oh, yeah, this is fine." And he's like, "Sister friend, no, it is not. This is blah, 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 blah." And I'm like, okay, this is good. Somebody who's walking life with me, especially if you have chronic illness and pain, it becomes so normal for you. So having someone live with you and also be able to advocate for you in ways that you may be blind to. So that's a really great point. Really great point.
Well, and I think especially as people who are socialized as women, we are far more likely to dismiss our own symptoms and how painful an experience can be for us. And having that advocate in there can help us to maybe overcome some of that social training we've received about people pleasing our providers and making sure that we're the well-behaved patient, that we're liked by everybody on those teams. So again, any coping tools you can find to address that people pleasing can be really beneficial as well.
Freezing and appeasing. I got to freeze and appease this doctor so that he will continue to advocate for me and I won't lose his, care or whatever. Yeah. Wow. Well, thank you so much for coming today. So remind the listeners how they can get in contact with you if they want to schedule an appointment with you or have questions for you.
Absolutely. So you can reach me at victoria@revivepractice.com, or you can check out my website, www.victoriarodrigueztherapy.com. This has been delightful. Thank you so much for giving all of those people who have experienced medical trauma a stage and a platform.
Absolutely. All right, you guys. I hope you have a wonderful day. Thank y'all so much for tuning in, and we'll talk to y'all next time.